Hi, it's Nikki here, Happy Hormones for Life, and today I'm talking about heart health, particularly for women over 50. You might not think that looking after your heart is your biggest priority as you go through menopause, but actually, it's not just a man's disease, it's actually the leading cause of death among women over the age of 50. And what's more concerning is that almost two-thirds of women who die suddenly from coronary heart disease show no previous symptoms, so you don't know it's coming. The good news is, though, that there's tons you can do naturally to look after your heart health, especially if you start in midlife. So, what are the risk factors for heart disease? Aside from genetics, going through menopause increases your risk of heart disease because estrogen plays a key role in heart health. Helps to protect your blood vessels from atherosclerosis, which is the buildup of fatty deposits in your arteries. So, declining levels through menopause can make you more susceptible to damaging those blood vessels. Other significant risk factors include high blood pressure, high LDL cholesterol, smoking, lack of exercise, poor diet, stress, poor sleep, alcohol, insulin resistance, diabetes, and obesity, the usual culprits. I'm going to talk a little bit about cholesterol because a lot of women tell me that their doctors have told them that their cholesterol is too high, and mine included. So unless you have genetically high cholesterol, often runs in family, before you take the recommended cholesterol lowering medication on offer, I want you to know more about cholesterol and how it works and what it does in the body, and obviously its many benefits as well. Cholesterol is a vital building block for steroid hormones, and that's your sex hormones. So it helps to control our mood and metabolism, inflammation, immune system, sexual functions, pretty much everything. The human body needs cholesterol in order for the body to function. So without it, we just wouldn't survive. So focusing solely on lowering your total cholesterol won't necessarily make you less susceptible to heart attacks. There are other critical factors like inflammation, like particle size, and that can offer a more accurate picture of your heart health risks. I'm going to list a few of the tests that you can do in addition to cholesterol that will give you a better, more comprehensive picture. There is a popular notion that LDL, low density lipoprotein, is bad cholesterol and that HDL is good cholesterol. It's a little bit of an oversimplification of their roles. Both types of LDL serve vital physiological functions, and their goodness or badness is kind of dependent on context, particularly their levels and their ratios. You are still, we are still relying on measuring total cholesterol levels and the ratio of LDL to HDL to assess a person's risk of developing heart disease. But actually, recent research suggests that measuring the number and the size of LDL and HDL particles, and particularly triglyceride levels, which are blood fats in the blood made from sugar, are actually a more accurate way to predict risk. But these tests aren't generally readily available at the doctors. There's also a growing concern in the scientific world that treating cholesterol levels too aggressively, such as with medication, can actually lead to too low levels. Levels under 4 nanomoles per litre have been shown to potentially increase risk of dementia in the elderly. So you want to really discuss with your healthcare provider to find the right treatment plan for you that balances the benefits of cholesterol lowering medication with potential risks of low cholesterol levels as well. So when you're evaluating your heart health, it's really important to do some critical thinking about what might be best for you. If you've been advised to take statin drugs, for instance, ask for some evidence on why they are recommending them for you. They might be perfect for you, but you need to know what you're doing and why you're taking them. Ask for details of your cholesterol levels. If your triglycerides are low, your HDL cholesterol is good or high, and it makes up a third of your total cholesterol, the chances are you'd be better off focusing on diet and lifestyle interventions first before starting medications that you're going to be on for life. I'm coming to that now. What are the natural ways to look after our heart and improve heart health? Medication has its place, of course. And especially HRT, which is naturally protective of your heart. But there are many, many diet and lifestyle interventions that can make a big difference, especially to mild or moderate conditions. The first one is vitamin B3 or niacin. This has been found to raise HDL levels by as much as 24%. Now you can find B3 in lots of different foods, including meat, chicken, beef, avocados, tomatoes, nuts, and seeds. Number 2 is to focus on your omega-3s. Get some omega-3s in your diet. Oily fish, grass-fed meat, free-range, organic poultry, nuts, olives, eggs, avocados, all are rich in those good fats. Number 3 is eating a Mediterranean-style diet with fewer refined carbs, plenty of veggies, protein, and healthy fats, in particular olive oil, which I really like and has been shown to help lower your triglycerides and raise your HDL. Number 4 is reducing sodium and increasing potassium and magnesium-rich foods. So really looking at reducing things like table salt. You can switch to sea salt, which naturally has less sodium in it. Lots of fresh fruit and vegetables, which will increase your potassium and magnesium. Beans, legumes, nuts, and seeds all contain good levels of magnesium as well. Number 5 is increasing nitric oxide. Now, nitric oxide is really important. It helps the vasodilation of our blood vessels, so it promotes better circulation and blood flow. Also helps with sexual function as well. So eating foods containing nitrates can help to increase production of nitric oxide in the body. So things like beetroot, leafy greens, cabbage, celery, rhubarb, parsley, things like that. Exposing skin to the sun can also trigger nitric oxide, as can nasal breathing, by the way. Number 6 is to stop smoking. Obviously, smoking doesn't help with any aspect of health, but it particularly can lower your HDL levels of cholesterol. It can constrict your blood vessels, and it raises your risk of heart attack in lots of ways. Number 7 is weight, managing your weight. Now, obviously that's tricky in midlife, but getting rid of excess pounds can actually improve your heart health. And even just a little bit of weight reduction can raise your HDL levels. Number 8 is exercise. Physical activity not only helps to regulate your blood pressure, improve your circulation, and get those nutrients around the body, but it also can raise your HDL cholesterol as well. Number 9 is, I've mentioned already, breath work and meditation. So a recent trial showed that regular meditation decreased the risk of death from heart attack and stroke by 48%. Nasal breathing, as I mentioned, also thought to increase nitric oxide. So those two are really helpful for heart health. Next is sleep. Now, irregular sleep patterns and irregular sleep durations can double your risk of heart disease. So make sure you're doing what you can to improve and regularize your sleep. And finally, helpful supplements. Now, a good multivitamin with active levels of B vitamins, magnesium, potassium, omega-3, DHA and EPAs, vitamin D and vitamin K2 are my particular favorites for heart health, and anything that's anti-inflammatory is going to help as well. And then further tests. Now, if you want that fully comprehensive picture of your heart health, you need to look beyond your cholesterol levels. You want to look at your thyroid function, get a full thyroid panel, because an underactive thyroid can push up cholesterol and affect your heart. You want to look at inflammation markers like CRP, clotting risk, fibrinogen, homocysteine levels, LDL particle size and number. You can get these done in private labs to give you a better picture of your cholesterol status. You want your triglycerides, your glycated hemoglobin, your HbA1c, insulin resistance markers. You want sex hormones, blood pressure. You want to look at your BMI, your waist circumference, and kind of infections as well. Things like H. pylori, herpes, and SIBO can affect your heart. And then, of course, genetic predispositions, which you're probably aware of. So there's lots of different tests that you can do that give you a bit of a fuller picture. So obviously, do contact us if you need any of those done, or you can't get them done through your doctor and you want to have a look at those. Hope that was helpful. And it's always good to look at other things other than hormones, because there are lots of things that can impact our health as we get older, and you've got to look after your health. I'll see you next time.